Can I start? Okay. It's coming? Okay. Well, hello, everyone. Thank you for taking time out of your lunch break to come to talk to me. This is my first time in Sydney, and looking at a beautiful city. It won't be the last. I'm going to talk to you about the intelligent web. If anyone is live tweeting, I encourage you to live tweet. That's my Twitter handle and Park's Twitter handle. So what I'll talk about is the evolution of the web and how it's gone, not from Web 1.0 to 2.0 to 3.0, which is kind of what the media talks about, but really what's happening with the web and how it's being used to influence people. And I'll take you through that journey using a couple of examples from areas I've worked in and try to touch on financial services towards the end. Park, as most of you know, is a research center, probably best known for having invented the modern personal computer, as you know it, the graphical user interface, Ethernet, mouse and window-based interfaces, laser printers, ubiquitous computing, early tablets. For the last 10 years, Park has been an independent company from Xerox and has worked in open innovation with large companies and little startups in many different areas, clean tech, printed flexible electronics, energy, many manufacturing, and my area, socio-cognitive computing. So the driving principle behind a lot of my work is this quote by the anthropologist Margaret Mead. She said, what people say, what people do, and what people say they do are entirely different things. Okay. Just think about that for a moment. If you're going to try to solve someone's problem, you can't ask them what their problem is. You can't ask them what solution they're looking for, because they don't know. They think they do, but they don't. So breakthroughs and disruption occur at this kind of Bermuda Triangle of technology, new types of business models, and most importantly, people, human behavior, and the context in which human behavior occurs. And so I'm going to have three big ideas in this talk for you to take away, and I'll put them up there so you can remember them. Big idea number one, innovation isn't about technology. It is fundamentally about people. Okay. My area is augmented social cognition, which is the use of social and mobile technologies to augment human cognition. We draw a lot of insight from cognitive science and psychology to try to bring that together with new technologies to impact the human thought process in different types of domains. Another way to think about it is we've developed technologies to make people smarter. Now, social networking isn't new. We've all seen social networking for a long, long time. What I'd like to do is work through what is new and what is the change that we are seeing. So if you think about the intelligent web, I said there were three stages. The very first stage of the web was around pushing information to people. We had websites and portals. You go to the web, you get information. We're now moving towards a stage of engagement where we want people not just to absorb information, but actually interact with that information and interact with each other over that information. The next stage, and the second stage is here now. The next stage is going to be on behavior change, or behavior shaping. We're going to be influencing people through the web. So they're not just digesting our information, they're not just interacting, but they're actually fundamentally changing their behavior. And I'll talk to you about how that's happening and what some of the lessons that have been learned is. So let me start with the domain that I'm working on, which is the problem of healthcare. Healthcare is a big problem, as you know. Right? Basically, we are spending more and more money to get fatter and sicker. Right? If you look at where the problem is, this is how the healthcare dollar gets spent. We have here on the left 1% of people consuming 25% of the healthcare cost across the country and, I dare say, across the world. Right? So this is one place where it's actually good to be in the other 99%. Right? The other 99%, the other 50% actually is using only 3% of the cost, and 95% is using about half the cost of the healthcare dollar. So there's clearly a disproportionate problem over here on the left side. We respond to this in the healthcare industry by focusing innovation on better healthcare treatments, better healthcare processes, better claims processing, more efficient workflow systems, electronic medical records. All of that is what I think of as the healthcare market. And one of the points I want to make is that health is a completely different problem from healthcare. Health is a problem that these folks over here care about. People like you and I, who are not sick, we're not in the hospital, we're probably not quite as well as we would like to be. And the challenge is, how do we help us avoid getting over here on the left? Because that's not good for us, makes us sick, and it also costs a lot of money. So the breakthrough opportunity in healthcare is this surprising statistic that 68% of adults, this was done in the US, it's probably similar here, 68% of adults are actively trying to prevent a major chronic illness. Not manage, prevent a major chronic illness, right? We want to move away from this reactive, fix me when I get sick approach to medicine to more of a proactive, long-term, preventive, holistic approach to medicine. The Centers for Disease Control reports that 50% of our health and personal health factors are due to lifestyle, diet and exercise and smoking and other things we do to cause harm to ourselves. So how do we help these people who are trying to get healthy, trying to stay well, get the right information they need, and in a timely way so that they can actually improve their health? Well, where do people get the healthcare information? Like with everything else, they go on the internet, right? This says first they do an online search. In fact, the internet is the leading source of health and wellness information. This chart is a little bit old, about 5 years old. Nowadays it's at about 82%, which is a much larger fraction of people than those who go to their doctors, their nurses, or a health professional for medical information. Now remember Margaret Mead, right? We may argue whether this is good or bad, but this is what people are doing. We have to deal with it. So if you think about this kind of model that I had earlier, the healthcare industry responded to this statistic by focusing on this idea of information. If you're going to the internet for information, let's build portals with information. In fact, there are lots of them. Here are some that you might have seen, and there are tons more. The Centers for Disease Control, there's Mayo Clinic, WebMD is one of the largest ones, many, many others. So we built all these portals. And so the question then you can ask is this working? Is this helping? So if you now go back to, again, what people actually do. When people go to the internet, where are they getting health information? They're not going to portals. They're going to social media. They're going to wikis and blogs and YouTube and podcasts and all of that. In fact, 96% of people use Facebook to get health information, which is crazy, right? That's a scary thought. But again, think of Margaret Mead. People are doing this. We're not going to change that. What we need to do is recognize it and leverage that. NPR Marketplace called this the biggest threat to healthcare portals like WebMD. And we still build portals. In the financial industry, we build portals. My bank has a portal for me. My financial planner has a portal for me. My insurance company has a portal for me. Guys, we don't use portals. It's not going to engage us. Okay? So how do we get engaged? So if you look at this chart again, engagement comes through social media. People are going to social media. And again, the industry responded with tons of social media sites. There are social media sites out there now, some that look a lot like Facebook, some that are quite different, for patients to engage with each other, for patients to engage with doctors, for doctors to engage with doctors, every combination you can think of. The other big driver of engagement is mobile. The mobile is the dominant platform for internet access now. More people are using their phones than desktop computers to get this kind of information. And again, the industry responded with mobile healthcare information. And there are, of course, all kinds of smartphone apps. I saw that at TEDMed. That's your smartphone physical. You can connect up your smartphone and actually give yourself a physical checkup. Glucometers. And it's not limited just to phones. You have things like bands that people are wearing and gadgets you wear on your hip, and even shirts that are instrumented to monitor your body and help you with health information. So a lot of mobile getting into this. And so if you look at where the trend is going, if you look at the language being used around all of these technologies, it's around this idea of empowering consumers, personal health. In fact, the buzzword is that the consumer is the CEO of their own health. The doctors are not in charge of your health, you are. The doctors are one tool you might use to take care of your health, but people want to be empowered. And so that's kind of the big idea number 2 I want to leave you with. If you want to make a difference to people, you have to empower them. You can't manage the health for them, you can't manage the finances for them, you can't manage the education for them. You have to empower them and be part of that conversation with them. So how do we do that? What's going to be next? How do we go beyond social and mobile information delivery systems to really trying to get this kind of engagement and control and decision-making from the consumer? What's the next big thing going to be? So I want to argue that the next frontier on the intelligent web is behavior change. After all, we don't just want to track your steps using a Fitbit. We want you to change your life as a result of that. We want you to pay attention to that data and do something different next time. Right? So it's all about influence, not just about information. So how do we get that influence? How do we change behavior? Well, the bad news is you don't. Okay. You're now saying, what is this guy's talking about? Why did you come here, right? You can't change people's behaviors because remember, you're not their CEO, they are. So the best you can do, and this is the way to do it, is you show them the way and you get the user to change his or her own behavior. And let me show you how we are trying to do this in a couple of domains, and then we'll see if this might extend to your problems. So the technology that's needed to do this goes beyond the stuff you wear on your belt or in your hand to modeling what's going on in your head. If I want to change your behavior, I have to start to understand you, your attitudes, your goals, your preferences, your likes, your dislikes, and they're very different from his or from hers. I have to get inside your head and build these highly personalized, what we call user models, and that's the next big frontier, modeling or user modeling. At Park, we call it hyper-personalization. Really accurate, individualized models that can help me get into your head and start to move some of those levers that are going to change your behavior in a long-term sustainable way. So we brought this together using a lot of science. I could probably give a whole lecture on this. I won't right now. But there's a lot of science of psychology and behavior change and what goes on in your head and why you choose to do certain things and how habits form. We've done a lot of research on that. And we brought that all together into an app. We call it Fiddle. It's a little fitness app. The idea is to leverage this user model, leverage social networks, create these little sort of teams of people who have a social contract with each other to keep each other on track. And we couple that with personalized coaching using artificial intelligence agents. The app is not public yet. If you're interested in this, at fiddle.org, you can sign up and we'll send you an email when it's ready for an open trial, probably in a couple of months. But we're piloting it right now, and you're seeing very good engagement from people through this combination of social and mobile and personalization. And we want to be able to do this at scale. If you're a Hollywood star and you can afford your personal trainer to come to your house every day, they can change your behavior. For most of us, how do we access that same kind of power with millions of people? So the way it works from a user perspective is actually very simple. You get the app. You either join a team or you make a team. And your team might be your coworkers. There might be your family members, your friends, a couple of high school friends. There might be strangers on the internet. Right? It's not a competition. It's not about leaderboards. Right? It's all about, can we create a small team of people to help change all of them together? You pick a program or a wellness challenge that you want to work in. So we have, where do they come from? You have a set of challenges. They may come from your doctor. They may come from a diet book. There may be your own thing, something that you've set yourself up as a personal goal to achieve. And then you execute this challenge. You kind of nudge along this inner elephant that is very slow and lumbering and slow to change its habits, and you gently move it in the right direction. As you're going through this, you're getting, there's some gamification involved to keep you engaged and get you badges, and then you advance to the next level and you do the next thing. So the idea isn't that this is a crash diet that's going to, you lose 10 pounds in a week, but rather over a period of time, weeks or months, you can make slow but sustained changes in your behavior that will then give you healthy habits for a lifetime. So we built all of this into a platform. Again, I won't do a technical talk right now, but this technology is built on a platform that can be repurposed to other domains. It doesn't have to be health. It can be behavior change in other types of domains as well. So our vision then is to provide this platform directly to consumers through apps or through a healthcare provider or a company to start to change their attitudes and their behaviors towards wellness and lifestyle choices around food and exercise and so forth. So that's health and wellness. Does this work for other domains? We've seen social media in pretty much every domain you can think of. So let me quickly give you one more example of another problem I worked on. It's the problem of education, another hard problem. Okay. So what's the problem with education? Right. One clear problem is scalability, access. Right. A third of the world's population is under 20. There are hundreds of millions of children who are qualified and interested in entering college that have no place to go. Right. Where are we going to put them? Sir John Daniel of the Commonwealth of Learning says we need to create a major university every week to accommodate this demand. I don't know about you, I haven't seen one being created every week, and this was 1996. This is an institutional solution to the problem. We need more of the same institution that's failing the kids, right? Let's look at what's actually happening. Why is education so hard, right? So the Bill Gates Foundation did this study called the Silent Epidemic Study looking at dropouts. And they came up with this staggering statistic. You should all be having a WTF moment right about now. 88% of dropouts have passing grades. Right? They're not failing. 88% of people who drop out of high school are doing well enough to pass. What's happening to them? Why are they dropping out? They're bored. They're not engaged. Classes are not relevant. They're not interesting. So we think, well, they're new millennials. Classes are boring. We'll throw technology at them. We'll give them apps and e-books and smart devices. Doesn't work. They don't like video lectures. They read electronic textbooks even less than traditional textbooks, right? That's not education. It's the same problem again that we had. Right? Just like with health and healthcare, we're trying to look at the problem of education, whereas the real problem is the problem of learning. Right? It's the problem of engaging these students and changing their behavior and their attitudes towards learning. So the way we addressed this was using very similar principles to Fiddle. We built a website. It's called openstudy.com. It's open and free. You can log in and encourage your kids to do so. And it's kind of a Facebook-like site where students get together and talk about mathematics and physics and finance and writing and all the subjects they're studying. So when you walk in, it's all real-time and live. It feels like kind of a busy Starbucks. You have groups of students huddled around different problems they're working on. And just like in a real Starbucks, they're talking about other things as well. Where are you from? How's the weather? They're flirting. But that's what keeps them engaged. In fact, our engagement numbers are enormously good. We have 4 million visitors a month from 180 countries. There are always hundreds of people on the site. 60% of them are repeat visitors. They come back. They spend 20 minutes a session every time they visit. That's a huge amount of engagement, especially for an education site. And when we asked them why they spend so much time, the word that really jumped out to me was, they say it's addictive. When's the last time someone said mathematics was addictive? They love it. They enjoy this experience because it is, at their level, it's engaging. Now, there are teachers on the site as well. Again, anyone can join. So some people are there because they enjoy teaching, and lots of people are there because they want to learn. So is it changing behavior? The Stanford Research Institute did an independent study of a group of students in our system, and they found huge amounts of behavior change. 80%, 79% more motivated to study. Their attitudes are changing. Their grades are up. They have better study habits. So through this engagement, through the social influence, through the gamification, we're starting to change people's attitudes and behaviors. And so our vision is, again, just like with Fiddle, to create this kind of worldwide network of people all kind of helping each other, in this case with learning. So that's kind of the third big idea. If you think about health versus healthcare, learning versus education, we need to focus not on the institutional problem, but on the human problem. What do people need for respect to health? Not what do hospitals need. What do people need, students need for learning? Not what do schools need. And that's how we change the system. So could we apply this to the FSI industry, to your industry, right? Now, I know nothing about the financial industry, but I've been a professor. I figure I can talk about stuff. These are the 4 big things I see that are impacting your business, right? Huge amounts of data, new types of security threats, new commerce platforms, things like Square and other peer lending and other things like that, and new customer channels, new ways to engage your customers or to engage your financial planners who are engaging their customers. And the latter is where I want to focus the challenge. Because again, we have the same problem, the problem of engagement. How are we going to engage people in thinking about their financial health, their insurance needs, and other issues that your business cares about through these new media? It's the exact same problem as education. It's the exact same problem as healthcare. We're going to have to engage them, and we are going to have to slowly change their attitudes and behaviors, treat you as part of the team, but empower them to take charge. So I'll leave you with kind of this challenge. I like to approach problems by thinking of a big, hairy, audacious goal, the BHAG. So for Fiddle, the big, hairy, audacious goal is to improve the health of millions of people. We are not there yet, we haven't launched yet, but that's kind of the dream. Go make an impact on millions of people, on their health. With Open Study, it's learning for millions of students. Those 100 million students who have nowhere to go, well, now they do. And they can teach each other, and it works. Right? So let's think about how we might use these principles to help millions with their financial health. And just to summarize in my last minute, the way we do this is to bring those 3 big ideas together. Remember that the innovation you need is going to be about people. Don't think about new technologies you need, but how we change people and get into their lives and change the ways in which they think and make decisions about their financial health. Focus on the human problem. Really look at what people need, get out there, work with them, study them, don't just ask them. Right? Don't think about what your companies need, but rather what the consumers need. And then empower these consumers to take charge. You will be part of the dialogue, because they're going to need a team to carry them through, and you'll be part of their team. But you can't go in and fix their problems for them. They have to be in charge. OK, so I'll stop now. We'll carry on the discussion through Q&A. That's my contact information. If anyone's interested, I'm happy to take LinkedIn requests if you want to carry on the conversation later. I do old-fashioned email as well, if you prefer that. Thank you very much.